Well, the thing is, you get into research because of the testing. You're testing these children for a genetic defect, but they're not all identical. You find 2 or 3 that have the same, and you start thinking, are they related? No, they're not related. It's just by chance. And then you find many more cases, and now we have about 80 different changes within the same gene, all of which cause Barth syndrome. And it's sort of like, it doesn't matter what defect you cause in the motor of a car, the car isn't going to run. I have a genetic database myself that we put it on the web openly, and many diseases have that on the web. They put collections of what they find as mutations, and I feel there is a big utility to that, because if a doctor gets a report that says this child has this type of mutation in the Barth gene, which is the TAS gene, its official name, then the first thing the doc asks, well, what can this mean? Or is there another child with that disease, with that particular change in the gene? Because it could be just a variant, just sort of like, one person is blonde and one is black-eyed and black-haired or whatever. So they ask, is this just a variant, a benign variant, or is it something real? Now, if you find that there are 2 or 3 other children with these changes that have these symptoms, then you start believing that, yes, that can be causing the symptoms. And so the field hasn't advanced that much because we have to find really safe ways, and that takes a lot of time. And you cannot start with humans. You have to start at a very low level, microorganisms, then animals, then humans. But then once things start happening, they can suddenly happen quick. It's just getting over the very initial difficulties, and they're difficulties. The repository is important because it will provide material to various scientists that will want to study this or that, different avenues of research. And especially because these boys have different mutations, that is, different defects within the same gene. And who knows if certain defects can be alleviated by a certain drug or a certain treatment, as opposed to a different defect that looks at the molecular level will be different, and that drug can't hit it. You may have to do things that specifically hit certain defects within the gene. I don't know, but those are things that can be tested. So if you have a repository with a big variety of cases, that is good. And the other important thing of the repository, actually of the registry, is the information. And in a wealth of information. And there the docs can also see what is similar among patients and what is different among them, because they vary tremendously. Sickle cell anemia, which is well known and common, is due to a single identical defect among all these people who suffer from the disease. Yet there's quite a bit of variation among them, and that has to do with their genetic background, what other genes they have in their body, in their cells. But still, sickle cell anemia, you only have one target there. Yes, we still haven't cured that one. We only have treatments for them. And so with Barth, it might be a bit more difficult, I don't know. So Barth has more variation, quite definitely. I think people in this group, especially because they come together with the Barth Foundation, and many are supported by it, they tend to collaborate much better. You see in some other diseases where groups of researchers hold separate meetings. I think it's in part because people come together because the Barth Syndrome Foundation brings them together, and perhaps because, I don't know, if Barth syndrome, the disease itself, selects the doctors in a way, people that might get interested in it, in a disease that is not very common.